Good evening, everyone. Welcome to the Doctors in the House Health Show on 99.1 FM, WUJM, St. Petersburg Community Radio. We have an excellent program for you tonight. Please stay tuned. Hello, we're here. Good evening to all of you. Welcome to the Doctors in the House, your health show. This is a program with topics about wellness, mental health, and disease preventions. I hope you're listening. You are now on 99.1 FM WMJ St. Petersburg Community Radio, or if you listen online, www.99gemstheberg.com. Welcome. And if you have any question, please do call us at 727-637-2416. The topic tonight is long haulers, COVID-19 conundrum. Simply mean the virus is not done yet. So we're going to tackle this topic today, which is very crucial, which essentially it is another manifestation of the coronavirus. Yet again, a devastating one, puzzling to the expert as well as to its victim. So some question for you. Have you heard about COVID-19 long haulers? Another name is post-COVID syndrome or lingering COVID symptoms. Do you know what it is? Is it possible maybe you or a loved one or friend have been dealing with this scourge, silently coping with it? So that's what we're going to get into. Just about a year ago, a number of infected patients with COVID noticed that long after the acute phase of the disease, they continued to feel sick and some extremely debilitated. So at that time, no one knows what it was about. And for lack of definition for what they were feeling, those patients that is, the term long haulers was coined. Everyone was puzzled, patients, doctors, because on and on, some folks never get better. And just imagine a year later now that we seems to know just a little better about it. So the National Institute of Health decided to call it PASE, which is a mouthful. It stands for Post-Acute Sequelae of SARS-CoV-2. And you can imagine why most people rather call this post-COVID syndrome or long COVID or long-term COVID. For those of you not familiar with this, there's plenty of manifestation of this because now it's getting more and more common, and most people have heard about it, perhaps. It goes something like this. Scenario number one. Suppose you are stricken with COVID-19, right? You become very ill for weeks. You may or may not have been admitted to the hospital because the criteria for the hospital at that time has been indication for oxygen therapy through ventilation. So you may not have been admitted to the hospital even though you might be severely sick. So you feel so sick for several days and so sick that when you wake up in the morning, you wonder, is this day maybe your last? And then you begin to turn the corner. Every day, your worst symptoms, the fever, the chill, the shaking chill, the terrible cough, the shortness of breath seems to get a little better. Hey, you're winning. You're breathing a little sign of relief because you're beating this life-threatening disease. And soon you no longer wonder if each day might be your last, because a couple of weeks or two, you hope that you're going to be returning to your old self again. However, weeks pass, and while the worst symptoms are gone, you find that you're not your old self, at least not even close. You're still feeling sick, but you cannot meet your usual responsibility either at home or if you had returned to work, you could. You have no energy. Even routine physical exertion like your daily chore at home, vacuuming, etc., leave you feeling exhausted. You still have lots of aches from head to toes. You're having trouble concentrating on anything, even watching TV. You're unusually forgetful. You stumble over simple math calculations. So your brain feels like this has been described. It's like in a fog. So you go to the doctor, right? Now, he or she congratulate you because the virus can no longer be found or detected in your body. That means you should be feeling fine. But you're not feeling fine. The doctor suggests that maybe the terrible experience of being sick with COVID-19 has left you a little depressed, anxious, stressed, maybe a little PTSD. So they suggest to you maybe, hey, why don't you try some psychiatric treatment? Maybe that would help. Since there's nothing physically wrong with you. So you have nothing to lose, so you decided to try the treatment, and it doesn't help. That's one scenario. Scenario number 2. You've recovered from a mild acute episode of what felt to you to be like a bad cold for a few days. And since everyone is talking about COVID, you decided to go get tested a week later just to be on the safe side. Relieved, your test is negative. So you thought to yourself, I was never really at risk, any major risk for anything. But a few weeks later, when you think you should have been great, bam, you develop some symptoms that were never there before. And we'll talk about the symptom. But nonetheless, even though you were not that sick, you feel debilitating. Scenario number 3. You feel absolutely fine. Nothing at all. You're out there partying. Because you were at that party where most people did not wear the mask, a friend finally convinced you to go get tested just in case again. You tested positive. Hey, no big deal. You heard there are a lot of asymptomatic carrier. You're one of them. You're young, no chronic disease. So, by courtesy to your friend and loved one, you spent a couple of days in quarantine and went back to your life as soon as possible. Except for one thing. You don't have the same level of energy you used to have anymore, you find out. Walking, riding your bike became a problem. You're really tired and have some difficulty with concentrations and remembering things, some mild lingering headache, a little taste loss, some sensation like this. This is somebody who actually was perfectly fine. So those are some of the few manifestation of the syndrome which has been described by the patient themselves for the past year. So what's going on here? Well, before I go on, let me tell you, this is actually an evolving problem, okay? I mean, just like from the beginning, we're learning as we go. So what's going on is that, a simple answer, you've been touched by COVID again, another aspect of the disease, which we are learning about. This virus has always taken the lead, and we doctors and scientists are left scratching our head. Nobody have had no major clue up until to this point. But meanwhile, tens of thousands of people in the United States and around the world, the majority of them are women, have been suffering this lingering illness following COVID-19 infection. Those are the long haulers. Okay, the term got stuck. Now, this time when folks realized that they were not being heard of by healthcare professional, describing stress, anxiety, the patient themselves took the lead and started organizing themselves, connecting with each other through social media outlet, Zoom and the like. And what they've been doing, they've been reporting the symptom. They've been describing, they've been sharing through social media each other. So just to pressure the medical community to take those symptoms seriously. So there has been a lot of published studies, minor studies here and there, and surveys, some conducted online by patient group and patient advocate themselves, that indicate that 50 to 80% of patients continue to have bothersome symptoms 3 months after the onset of COVID-19, even after tests no longer detect the virus. So what's going on here? Who get this? Is there any particular type or risk factor for any particular people who are getting the syndrome? So one of the study actually was done very early at University of Washington, Seattle. Shows that about 33% of COVID patients who were never sick enough to require hospitalization continue to complain months later of symptoms like fatigue, loss of smell, loss of taste, and this popular brain fog. The nearly 200 Seattle area patients tracked in the study were relatively young and healthy, explained Dr. Englund, an infectious disease specialist who lead the Cleveland Clinic COVID long hauler recovery clinic. Another piece of data shows that more than 90% of the patients, the average age is about 48, had mild to moderate symptoms without any hospitalization or risk factors. So there's no risk factors involving the average folks. Things like high blood pressure, diabetes, or smoking, obesity, things that we've associated with severe illness. But in this case, a lot of those people, they were not hospitalized, and they had mild symptoms, moderate symptoms, and they still have this syndrome. So one of the physicians, lead doctor, says, if you contract coronavirus, there is a good chance you could experience a lingering effect. So this preliminary results here and there shows that why everyone should protect themselves against coronavirus by continuing to follow the CDC guidelines. Simple mask wearing, especially indoor, self-distancing, and watching. You've heard this before, right? Over and over. Even the fact that we have a vaccine. Because those variants are still circulating, and until there's a declaration that this is officially over, you still have to take precaution, okay? Remember, the vaccine makers, both Pfizer and Moderna and the like, certainly said to you that you're going to be protected 95% of death, severe hospitalization. But the question about infection still remains floating. So you could have the vaccine and still get infected. So then you become a threat to others. So continue to wear the mask to protect yourself, but also to be kind to your community, your family members. The potential to suffer long-term symptoms from COVID infection increase slightly with age, another team have found. About 27% of patients between the age of 18 and 39 reported persistent symptoms, compared to 30% of those between 40 and 64. And 43% of those age 65 and older also have the same symptom. But if you look at the number here, it's distributed almost equally across the board, except the older you get, the more you may be likely to have sicker disease and hospitalized and carry a burden, because a lot of people have scar tissue that are left by the COVID disease, COVID-19. And if you figured that as of now there are 31 million COVID-19 infections reported in the United States, which could mean that millions of Americans suffering from those symptoms that last months and possibly years, she said. So if you take a portion of it, 10 to 30% of that 31 million, there's a lot of potential for quality of life to decrease for a lot of people in the next 6 to 9 months. That's a huge number. Now, we did mention that women in some of the study were at higher risk. And this is one example of this. From the post-COVID syndrome research at the Mayo Clinic, it is reported that approximately there have been 20,000 patients tested positive for the coronavirus there. And roughly 10% of them are considered long haulers. And of the 10% long haulers, 60 to 80% of these patients are women. So again, women is bearing the blunt of this, just from a disease point of view, from a physical point of view. Now, we're talking about symptoms. Not everybody really have the same symptoms. Some people have minor symptoms at the beginning, and then when they were supposed to get better, those lingering symptoms start a new one in addition to what they may have felt before. So some of the symptoms that most commonly people experience: fatigue, body aches, shortness of breath. And probably in different order: shortness of breath, body fatigue. A lot of people suffer heart palpitation because there's been evidence of heart damage. Difficulty with concentrating, that's the part of the brain fog. With memory, some memory difficulty, the inability to put words together. Okay, so that's some cognitive loss. As I said before, inability to exercise, headache, difficulty sleeping, dizziness, this gnawing, loss of taste and smell, joint pain, muscle pain, some GI symptom, insomnia. So since COVID-19 is a new disease that first appeared around December 2019, we have no information on long-term recovery rates. As I said, all the stuff is evolving and we're learning as we go. So what causes post-COVID syndrome? This is the puzzle. Okay. In the beginning, it was assumed that you're going to find all the sick patients, folks with chronic risk factor, high blood pressure, diabetes, obesity, other condition would be more likely to have serious bout of COVID. But guess what? There's not really clear link between those risk factors and the long-term problem people are experiencing. In fact, the long COVID can happen in people who have mild symptoms, in young folks who who are completely healthy, and out of the blue, they get sick or they don't recover, and this can drag. So typically, if you want to ask me about when this thing usually starts, it's usually 4 to 8 weeks after the first episode, so to speak. Okay, because at that time, a lot of people, especially young people who are healthy, think that they should be getting better, and then that's when trouble may start. The other thing we know for sure is that SARS-CoV-2, which is the coronavirus, can attack the body in a variety of ways, causing damage to the lung, to the heart, to the nervous system, to the kidney, liver, and other organ. Mental health problems arise from grief, loss, unresolved pain and fatigue, post-traumatic stress disorder, and a whole slew of issues, especially those who've been treated in the intensive care unit. According to Dr. Emily Brigham, MD, MS, MPH, who specializes in lung disease and critical care, she said, "We are seeing a spectrum of symptoms after acute COVID, some of which would be expected after other clinical illness. Some people have minor problems, but other people may need long-term care, even readmission from time to time to the hospital." She continued, "What's curious, though, is that it seems post-COVID-19 syndrome is not just afflicting people who were very sick with the coronavirus. As we mentioned before, people who were never severely ill are coming to the clinic and saying that their lives are different now." So the moral of the story is, you got a couple of ways to prevent this nightmare, I call it. First, avoid getting infected at all. I made that pledge to myself. Thank God, so far so good. Okay, because now we find out it's not just you die, you have long-term complication natural from the disease, but this unexplained lingering symptoms that follow COVID have everybody scratching their head. They really don't know. And then we are just all looking and actually for the first time really pay attention to the patient when they present to us as physicians and they're not being told that it's in their head, because this is real. And you could see what happened with the challenge of COVID going to pose for the healthcare system. Okay, the sheer scale of caring for those people with lingering COVID-19 is such a serious challenge. In the past, physicians have seen post-viral illness. I mean, it's clearly there's a lot of disease that usually have a follow-up by a period of recovering. They get fatigue, even simple bronchitis. Sometimes your cough may be resolving, but you're feeling better, but the cough hanging in there and drag, or you may feel fatigue. And previous coronavirus have had some of this stuff. It's not completely new, okay? Physicians who have treated acute respiratory syndrome, SARS-1, and the other Middle East respiratory syndrome, MERS, who were coronavirus, they've seen this, but the outbreak were limited. I think there was a total of 8,000 to 10,000 patients who really were very, very sick. But now, million more people have had COVID than SARS and MERS. So the potential problem of lingering health problem is huge, particularly in this context of the pandemic with social isolation, economic disadvantage, lack of access to care, and change in daily routine further complicated this problem. Somebody asked, how long this start? How long can long-term COVID or long COVID last? So the answer is, we don't know. When it comes to COVID-19, how long is long-term? We don't know. The answer is unknown. It will take longer to understand what is next for patients who have recovered from COVID-19 and who still have resulting problems. So is there any good news? How do we treat this? Well, one of the things that happened as many people are being discovered and are really searching all over for clinics and doctors and therapists, there's a lot of special clinic, multidisciplinary clinic that are being opened in the majority of major hospitals and clinic. For instance, here in Florida, right there in Lakeland, Watson Clinic has opened a special clinic just for those long haulers, long COVID patients, because they're going to last for a while. And they have to follow them. Multidisciplinary mean they have pulmonary, they have neurology, they have cardiology, they have psychiatry involved, and also they have behavioral therapists, and they have physical therapy, rehabilitations, a whole slew. So in addition to eliminate other diseases that the patient may have, and they have to train them in breathing exercise, physical therapy, medication when they need. So this is being done. In the meantime, you can still get access to, because most primary care of regular physicians are being aware of this, okay? And one of the things primary care physicians should be good at is to listen to the patients, believe them until proven otherwise, and kind of offer empathy, because that goes a long way when somebody trusts that you listen to them and you care about them. So you get along. Because a lot of people actually get better by themselves, okay? They get better over time. It may take time, but they get better with encouragement and slowly. We had a patient in one of our shows on a Monday night. She had been sick. She's a hairdresser who lives in Virginia. She had been sick with COVID and very sick. So we talked to her about a month ago, okay? She had, for the most part, recovered, but she's still complaining of that brain fog. But, she had to work. She had to reopen her store and cope with it. So a lot of people may not be completely better, but they're coping. They're able to cope. So this is stuff. Now, there's some good news, though. The good news is, and it's not something that being researched yet, but it's something that the patient themselves are reporting. Those who have taken the vaccine are reporting feeling better a week, 2 weeks after they get the vaccine. So that's even make the scientists scratch their head more to ask, what's going on? All right. So how do we prevent long-term COVID? We talked about it. Really, avoid getting sick. Follow those protocols, okay? And now that the vaccine is being offered, please take the vaccine. Because in the likelihood you were infected and now you develop some long COVID, the vaccine seems to provide some relief. But this has to be confirmed by formal research, the random controlled trial that they have to do big term where they compare, they classify people. So should you see a doctor for this? The answer is yes, because if you've had COVID, they sent you home. When you were supposed to get better, you're not, and you're developing this bizarre symptom, this disabling symptoms. You should see a doctor. Maybe you have some cardiac issue. Maybe you have some lung issue. Do not ignore any symptom that interfere with your daily life. It's worth to call your doctor, who can help at least put you in the right direction, address some of the problem, and hopefully improve the quality of your life. So I'm going to summarize what I could have tell you from the beginning of the show, but you were already prepared to listen, so I do. You already know COVID is a killer disease. You have the evidence. U.S. death, over 560,000, 30 million infected. Now you have this symptom. So COVID now is going to leave behind millions of people who are going to have severe physical and mental disability for a long time. A lot of them will get better, but a lot of them, a year later, still having some issues. And worth repeating again, you can prevent all this by not getting infected, wearing your mask, and follow those guidelines. I'll repeat it again plenty of time. And get the vaccine, which are safe. At least those 2 vaccines that are being given right now, the Moderna and Pfizer, so far have been remarkable, okay, in preventing people from getting very sick or from dying. And you could see since the vaccine being given, the death rate, the hospitalization rate, everything is plummeting. But we are not dead. We are not done yet. The virus is not done yet, because you could see now multiple variants are emerging. Okay, and those variants, some of them may not necessarily, the vaccine may not necessarily be covering. Right now, the good news is those 2 vaccines, Moderna and Pfizer, are really taking care of. I've been able to take care of the variant from UK, the B117, which is now really propagating, and all the other little variants. The only one that may be a problem is the South African variant, but they're not too many. They haven't found too many in circulation in the United States. And I said finally to conclude, if you're unfortunate enough to suffer from complication of COVID and you belong to that group of long hauler, there's no specific treatment except supportive care and time. get the vaccine. If we all get vaccinated, we can get rid of this awful pandemic sooner or later. My friend, ladies and gentlemen, I thank you for your attention. Tell me if you like this show. And I'm going to keep you posted because this is an evolving subject. All right. Please give us some feedback at 727-637-2416. Please support this radio station for helping me to bring the show on the air.